Bismillahirrahmanirrahim. My topic today is about lecture about understanding DC and VC. Alhamdulillah wa salatu wa salam ala rasulullah wa ala alihi wa sahbihi wa sallam ajma'in. Allahumma anfa'ni bima 'allamtani wa 'allimni bima yanfa'uni wa zidni 'ilman innaka al-'alimul hakim. Allahumma akhrijna min ظلمات الوهم وأكرمنا بنور الفهم وافتح علينا بمعرفة العلم وسهل أخلاقنا بالحلم اللهم آمين. اللهم ارزقني نعمة الإخلاص لوجهك الكريم بكل ما أقول وبكل ما أفعل آمين يا رب العالمين. Before we starting our lecture, let us see some normal anatomy. As you know, this is the BA wrist view, and as you know, the wrist is composed of complex joint and formed by 20 interdependent articulation binding 15 bones, radius and ulna, and 8 carpal bones, scaphoid, lunate, triquetrum, pisiform, hamate, capitate, trapezoid, and trapezium, and 5 bases of the metacarpal bone. Here, this is a normal lateral view. Here, this is the dorsal aspect of the wrist, and we see the capitate, hamate, and the triquetrum. And in the volar aspect, we see the pisiform here, and the scaphoid, and the trapezium. And here we see the lunate on the radius. Here be another BA view, and we see 3 lines called Gillold's lines. Line or arc number 1, it is along the proximal aspect of the carpal bone, and it is in red. This is the scaphoid, lunate, and pisiform. And the line number 2, it is along the distal aspect of the carpal bone, and this is the line number 2. And line number 3, it is along the proximal convex curvature of the capitate and hamate. Any disruption of these arcs or any overlapping of the adjacent bones commonly indicate underlying carpal instability or fracture. Here we have the intercalated segment, we have the scaphoid and the lunate and the triquetrum. Normally the scaphoid has tendency to flex or move volarly, while the triquetrum, it is move dorsally in a stable rest. The lunate is in the middle and balanced by the forces. Here we have the scapholunate ligament, and here we have the luno-triquetral ligament. Normally, the normal capitolunate angle is less than 30 degrees. Normal, the scapholunate angle is between 30 to 60 degrees. More than 60, in some books more than 70, it is abnormal. And less than 30, it is also abnormal. What is DISI? DISI, it is A dorsal intercalated segment instability is a form of instability involving the wrist, and can be caused by trauma with or without fracture. We have the bony disi. It is related to scaphoid fracture, and we have distal radius fracture, and it is called compensatory disi, and we have the ligamentum disi. It is due to scapholunate ligament dissociation. It occurs after disruption of the scapholunate ligament and is more often encountered than the volar intercalated segment instability VISI. Here in DZ, we have the scaphoid. It is moved volarly or anteriorly due to scapholunate ligament dissociation, and the lunate and the triquetrum, it is moved dorsally. And the angles, as we said, the normal capitolunate angle is less than 30. In DC, the capitolunate angle is more than 30. And the scapholunate angle, it is in normal patient between 30 and 60, and in DZ it is more than 60, and in some books or some literature it is called more than 70. What are the imaging findings in DZ? We have in the BA view wrist X-ray, we have the scapholunate gap more than 3 millimeter. In some books, it is called more than 5 millimeter. And this sign, it is called teratoma sign, as you know. And we have cortical ring sign. It is caused by scaphoid malalignment. On the lateral view, we have dorsal tilt of the lunate due to scapholunate angle more than 70, or in some books more than 60 due to neutral rotation. And capitolunate angle, it is more than 20. So let us see some example. We have here the scaphoid. This is the scaphoid and this is the lunate, and there is increased distance between the scapholunate, and this is gap more than 3 millimeter or 5 millimeter, and it is called teratoma sign. Here, this is another patient with cortical ring sign due to malalignment of the scaphoid, and also we have the gap between scaphoid and lunate more than 3 to 5 millimeter. And here the scapholunate angle is about 83, and normally it is up to 60, and some books up to 70, and we have dorsal displacement of the lunate. We have the dorsal here, and the volar aspect is here. And here, this patient with dorsal intercalated segment of the lunate, and we have dorsal instability, and the capitolunate angle is about 30. Here another patient with DZ, and the scapholunate angle is more than, it is about 97, and here we see in the yellow we have the scaphoid, and this is the lunate with dorsal deformity. dorsal deformity. Here, this is the normal rest for comparison. Here, this is the BA, and we have the disruption of the arcs, the arc number 1 between scaphoid lunate and the triquetrum, and arc number 2 in the yellow. And here, this is the normal rest for comparison. What is VISI? VISI is volar intercalated segment instability, is a type of instability involving the wrist, is less often encountered than dorsal intercalated segment instability, and in some books may be a normal variant. In VISI, we have the scaphoid moves volarly or anteriorly, and the lunate moves also volarly or anteriorly due to disruption of the luno-triquetral ligament, and the triquetrum, it is moved the posteriorly. The normal, as we said, normal capitolunate angle is less than 30. In DZ, it is more than 30. And in VZ, it is less than 30. And the scapholunate angle in normal is between 30 and 60. In DZ, it is more than 60 or 70 in some books, and in the VZ, it is less than 30. What are the imaging? The imaging, we have volar reflection of the lunate lead to scapholunate angle less than 30. And capitolunate zigzag deformity with angle about less than 30, and it is less than 30 can be 15. In the BA view, unlike the scapholunate, dissociation may not be widening of the lunate triquetrum interval. A break in the arcs, and we have the proximal translation of the triquetrum with or without lunate triquetrum overlap. Here we have patient with VISI, as we see disruption of the arcs and volar displacement of the lunate, and we have the lunate, it is a triquetral, triangular in shape, as we see in this BA view and this BA view. And the scapholunate angle, scapholunate angle is less than 30. In summary, DZ is dorsal intercalated segment in instability, dorsiflexion, carpal instability. In VZ, it is volar intercalated segment instability or volar flexion carpal instability. The scapholunate in DZ is more than 60, and it is in the scapholunate angle in VZ is less than 30, and the capitolunate angle is on DZ is more than 30, and in the VZ is more than 30. Radial side ligamental injury, as we said, the scapholunate ligament dissociation, and here the ulnar side ligament injury, it is the luno triquetral ligament injury. Thank you for listening and hoping to see you soon in another talk. سبحانك اللهم وبحمدك أشهد أن لا إله إلا أنت أستغفرك وأتوب إليك.